Hello everybody, I'm Dr. Burness, and I run a concussion-focused functional neurology and chiropractic practice in Oakville, Ontario. Got a message this morning from Daniel, and Daniel says, I've been suffering with concussion symptoms of brain fog and headaches since August 2019. I've seen many doctors since then with little help. What can I be doing right now to help myself? Can you give me some exercises to do? Well, Daniel, short answer would be no, I can't give you any exercises to do, but there are some things that you can be doing. So, when anybody tells me they have brain fog, that's a big red flag for brain inflammation in my books and my experience. So one of the things we need to do, and you can do at home, is to put yourself on an anti-inflammatory diet and supplement protocol. That's one thing that's pretty much common to all my concussion patients. I have them all doing that. And again, that's something you can do at home. And if you would like to do that, my diet, I think I've outlined it roughly in another video. You can look for that. I don't know how to do the link thing, but I'll sort that out over time, I suppose. But so you could look at that other video. But the diet that I use is an anti-inflammatory diet, of course, but some parts of it are generic and other parts of it are specific to the patient. And so the specific, not so much to their symptoms, but to their physiology. I like to do sensitivity testing and things like that. Basically, I try and remove everything from that person's diet that might be driving inflammation for them at all, and that requires some testing. But if you're out there, somebody out there watching this video, and you'd like to try that, and I think everybody should if you've had a concussion and you haven't tried it yet, reach out to me through my webpage. Again, there's a contact page on the website. If you just fill out this form here, this goes right to my desk, and I'm happy to try and answer any questions that you have, and maybe we could set up a time for us to either speak on the phone or Zoom. We could maybe even do it through Zoom. I'm not Zoom fluent yet, but I'm working on it. And I'd be happy to try and point you in the right direction in terms of diet and testing and stuff like that. So that's one thing that everybody can do. The other part of your question, can you give me some exercises to do? And that's the part I got to say a hard no to. And not because exercises aren't helpful, but specific exercises are helpful to specific problems, right? So, just like pushing yourself to the point of symptoms at work and school is going to make you worse, doing the wrong exercises for your problems is a good chance it's going to make you worse. So we don't do that. I don't know enough about you to say what exercises you should be doing. I would have to examine you. Kind of like calling an auto mechanic if your car's not working and just calling him on the phone and saying, hey, my car doesn't run. What can I do? Mechanic can't tell you what to do. He needs to see the car, and it's the same, unfortunately, with the brain. So hopefully that answers your questions. And again, if anybody wants to contact me, again, go through my website. I'm happy to try and answer any questions that come my way. Thanks for watching.